120
Exactly.
pounds down. That's amazing. That's a lot of 10-pound sacks of potatoes that you have lost.
Welcome to my channel. My name is Dr. Brandon Andrew, and I'm a board certified and fellowship trained general and bariatric surgeon and fellow of the American College of Surgeons.
I want to bring Lynn in here just very quickly. Thanks again for joining us, Lynn. Which version of this surgery did you have?
I had the gastric sleeve.
Okay. And when you first met with Dr. Andrew, do you mind telling us where you were at in your journey? What was difficult in life? What made you decide to actually reach out and talk to Dr. Andrew?
Pretty much just, I hurt all the time. I had already had 2 knee replacements, and, I just hurt all the time, and I was tired of it, and I knew I needed to do something, and I just did some research and found Dr. Andrew and made an appointment with him.
So the challenge with bariatric surgery is making the big changes you need to make to your diet and lifestyle. And that means changing the habits that someone may have had for decades of their life. So it really takes a lot of hard work and commitment. Bariatric surgery programs are not the easy way out, as some people may have said. It really takes a lot of work, and the patients in the program have worked very hard and made a lot of change, just like Lynn has as well.
Yeah, I was going to ask you, Lynn, I'm guessing that you tried diet, you tried exercise, you tried to get the weight off, and it wasn't working. Would
Correct.
you say that that's correct? Okay. What
Yes,
kinds of things did you do to try?
Well, I did lose about 50 pounds, and then a lot of personal family issues, and it just came right back on, and that's about it. Just one of those things.
It was just a struggle, and you said that you were in pain all the time, and you just said enough is enough.
Yes. Exactly.
Okay, absolutely. Lynn, I want to go back to you for just a minute here. What benefits have you seen now that you've had the surgery and you've been working with Dr. Andrew? I'm assuming you don't hurt anymore. That's probably a big one.
Yeah. Yep. I saw little aches and pains, but nothing like it was before. I'm off my blood pressure medication. I can go out and I can walk 2 miles, where before I had the surgery, there's no way I could have done that. So I just have more energy. I just want to get out and do more things, where before I just didn't care because I didn't feel good.
Mm-hmm.
Did you think when you first started looking into this that you would receive the emotional support and the mental support and all of these other layers that came with having the surgery?
Not necessarily. I learned a lot. I did a little research online before I made the appointment with Dr. Andrew. And after the first appointment, you learn a lot more, what you're in store for, I guess to say, once you have the first chat with him.
Sure. But it sounds like you've definitely received a lot of help in those other areas, that it's more than what you had expected.
Oh, yes, definitely.
Yep. I was going to ask you, Lynn, if that was something that worried you before you had surgery, that you must have known going in that, okay, I'm going to have to eat well now the rest of my life. Was that something that worried you, or that was a big concern for you, or has it not been that much of a challenge?
In the beginning, I think I worried about it, but now I'm just kind of into everything, and it's just been working for me. It's not like I'm never tempted to have 5 cookies, but I just don't. I'll have 1 cookie instead of 5.
So would you say that you've had to change sort of your mental approach to how you're eating, and obviously it's working for you?
Yeah, you have it. If you go into it, once you have the surgery and you start feeling better and start maybe getting hunger pains, if you're going to start eating like you were before you had the surgery, that weight's going to come right back on. So, you have to follow the program.
So at that point, you've put the work in, and there's no reason you're going to go backward.
I'm praying I don't go backward.
So, Lynn, I want to ask you about a concern that you had. What was your biggest concern? Was it a lack of knowledge of treatment options? Was it the cost? Was it worrying about the foods? What was it for you?
In deciding to have the surgery?
Yeah, your
Is that what you're asking?
your biggest concern before you said, let's do this.
Probably the cost, and then wondering if I was going to be in a lot of pain or be really nauseous, because that's not the most pleasant thing. I had absolutely no nausea at all, so pain was very manageable. For me, the cost was, with copays, probably less than $2,000. I didn't have a deductible, I just had copays, so
Okay.
that was probably my fewest worries.
So would you advise people to at least start the conversation with Dr. Andrew before ruling it in or out?
Absolutely. Just go for a consult. Just at least do that. And they'll explain everything, what to expect.
Okay. And how much weight have you lost now in total, and are you keeping it off?
I've lost about 120 pounds, and yes, I am, right now I'm holding right there. I'm kind of in a stall, so I keep getting on that scale going, come on, move, and it just doesn't want to move, but it will eventually again.
Well, and that's for anyone, whether you have the surgery or not. You know, you always hit that plateau. But 120 pounds down, that's amazing. That's a lot of 10-pound sacks of potatoes that you have lost, and you're not carrying around anymore.
Right, absolutely. And I think, Lynn says it very casually, but I think 120 pounds is something that really should be celebrated. She's done very, very well. She's worked very, very hard and made a lot of changes, and she's being successful for that reason. And Karen, I think you make a good point. If you think of it as, let's say someone loses 100 pounds. If you put a 100-pound weight vest on a 60-year-old woman, imagine how difficult that's going to be for her every step that she takes. Just doing anything more than a few minutes throughout the day is going to be very, very challenging. And then
absolutely
take that off, how much better things are going to be in terms of joint pain, mobility, etc., breathing, as you can imagine. So I think that's a very good visualization.
Yeah, absolutely. And for me, it's always that 10-pound bag of potatoes, that I think about. And, back when I used to go to the grocery store, pre-COVID, I would lift that bag and I thought, gosh, you add 4, 5, 6, 7 of these. That's painful.
Right.
That's a lot of extra weight. So if people can benefit from something like this, I think it's important to get them the right information. Lynn, what would you tell someone if they're thinking about this and they're on the fence? They're hearing this information tonight and they kind of want to know more, but they really can't decide what step they should take next. What would you say to convince them to at least have a consult with Dr. Andrew?
Think about what your life could be if you lost some weight. That would, at least have the consult. My life has changed. I have new clothes. It's just, I want to get out and do things, and their life could be changed if they went through the surgery, if they followed the plan.
Thoughts, Lynn, is there anything final that you would tell people as they're moving forward with this journey?
Go for it. It's going to change your life. That's the best advice I have.
Congratulations on your success, and thank you so much for joining us. It's great to put a face with a name and to be able to see someone who has had such great success. So we really appreciate you joining us.
Oh, you are more than welcome.
Please visit our website, myweightloss.me, where you can find information on the services we offer, see our results, and learn more about the program. This should be one of your first steps in learning about our program. You can learn about the services we provide in terms of surgery and medical weight loss. Also read more about what makes our program special. See our results, including multiple patient before and after picture videos. And most importantly, find out how to get started on your weight loss journey. You can contact us through the website or by calling the number listed on the screen. We also have telehealth visits available for those who have a long way to travel. Thanks for watching. Until next time.